First of all, Dublin. You and I discussed Dublin
Yes.
yesterday, and as you're aware, predating your tenure, very significant sterilization failures that led to the potential exposure of thousands of Georgia veterans to bloodborne diseases, and indeed, some of those who may have been exposed later tested positive for HIV and hepatitis. In March of this year, the Inspector General conducted an additional inspection of facilities at Dublin and found continued egregious failures. Can you assure the subcommittee and Georgia veterans that these issues at Dublin have been resolved?
Yes. I've actually been to Dublin. I was there about 2 months ago, and we've gotten reports since then. This was about the time Dr. Lieberman, who is our chief doctor, who is over VHA, has confirmed this as well, that those have been replaced. The problem there is a conversation we just had a few minutes ago about leadership, and that's what we're trying to correct. Right now, there's still, we're trying to get permanent leadership into the Dublin facility, and for those who may not know the Dublin facility, this is a facility. It's a great part of the state of Georgia. That's my, sort of, I got a lot of friends and family down there, but it's harder to recruit down there. It's harder to get folks to come into that facility and want to be there long term. So we're trying to work that out, because I think this is a leadership problem that
and forgive me, Mr. Secretary, I want to get to the leadership at Dublin, but just to be clear, in order to ensure that we're informing the public, your testimony is that these issues have been resolved at Dublin. And does that include all of the outstanding Inspector General recommendations that were found in March? The March 6th report says that there were significant failures to resolve previous OIG identified deficiencies, failure to fully implement SensiTrack, which is an electronic surgical instrument tracking system, failure to address concerns of the SensiTrack coordinator's performance on implementation, failures to resolve concerns related to sterilization facilities. Have all of the Inspector General recommendations with respect to Dublin sterilization, which were not yet implemented in March, now been implemented? No problem.
To my understanding, yes. And I'll be happy to, because this is, again, for you and I both in Georgia. I'll be happy to go back and look at that again. My understanding is, yes, Dr. Lieberman said it has, but I'll be happy to go back and look at that and make sure.
Yeah, and that same March inspection, in addition to the not yet completed or implemented recommendations from the past OIG report, again at Dublin, this is March, the OIG determined that sterilization and operating room staff failed to remove non-conforming surgical instruments from the rectal tray. OIG found additional surgical instruments in non-conforming condition, and that contrary to policy, staff reprocessed and used non-conforming instruments at the facility. A range of other failures. That was in March. So your assurance that the Inspector General's recommendations have been implemented is appreciated, and I would welcome any follow-up you can provide as soon as possible so that we can reassure folks who are served by this Dublin facility that they're safe getting care there.
I will definitely do that, and not to give away, there's some issues at Dublin, especially with this. This is, as you well know, probably before your tenure as well and mine as well, Dublin has had this, there's been some issues down there before. We're going to make sure we're staying on top of it. But I will, again, correct you, and I'll get you some information.
And you mentioned that at Dublin, leadership is a major issue.
Yes.
And as of, we got this report in May. So as of May 9th, we received a report that the recruitment of a new medical director at Dublin was on hold due to the hiring freeze. Now, I know you have faced substantial pushback on the effects of that hiring freeze. Can you confirm that you've changed course and you've exempted that position now from the hiring freeze?
Those are exempted, yes. As I shared yesterday on the phone, those are exempted, yes.
Okay. And when was that exemption made? Because this was we got this on May 9th, said that recruitment of a new Dublin
May 15th.
Director. May 15th.
Yeah.
Okay, thank you very much.
So that would have been after.
Atlanta. Recent Inspector General report focused on Atlanta. This is a June 12th report. on staffing shortages, among other issues. Now, and I think you know this, Mr. Secretary, for years, the wait times at the VA Medical Center in Atlanta have been driven in large part by staffing shortages. I've heard it from the leadership there year after year. This Inspector General report found, as of June 12th, 208 vacancies at the Atlanta VA, including 67 provider, 42 registered nurse, 32 licensed practical nurse, 49 medical support assistant, and 18 pharmacist positions short at the Atlanta VA. What is your goal, the date that you'd like to bring the Atlanta VA up to full staffing, please?
To hire them all. If you got any,
and by when is my question?
As soon as possible. I mean, there's no delay here in this. This is and I think if we would also look at the Atlanta market as well in healthcare, we'd also see other at Piedmont, also at Northside, also at the St. Joe's and others having similar shortages in their staffing. Atlanta is a market, like a lot of other markets, in which healthcare, especially CNAs, LPNs, or RNs, are in great demand. They're the ones that are controlling the market. So is doctors as well.
And the wait times, as you know, in Atlanta are a particular issue. Of course, there are wait times at other facilities as well. But I appreciate your ambition.
There's nothing stopping.
I appreciate the ambition of as soon as possible, but I'd like to know. I mean, we'd like to work toward a deadline. So, can you give me a date by which you'd like to ensure the Atlanta VA is fully staffed?
Well, Senator, I think you know that that's not something I can give you, but I'd be happy to do a health fair with you, and I'd come down and you and I could recruit these workers.
Well, I tell you what. Why don't you?
I'd be happy. I mean, we'd be happy to do. I'm not trying to be funny here.
I know.
I want to do this.
I'd love to work with you. I'd love to work with you to make sure we recruit those healthcare workers. But what I'd also like you to do is to get with your staff, get with the VISN, get with the leadership at the Atlanta VA, and come back to me and the subcommittee with a date by which you believe you can fill those open positions. Can you do that?
Well, I would definitely get the information to see what their goals and targets are.
Well, we got to have a goal.
Yeah, and I agree with you. So we'll get with that and we'll see what we can.
So you'll come back with a date?
We'll see. Well, I'm not sure we'll get a date. I'll have to talk to Atlanta. I mean, we'll see what their actual recruitment is. Because, I mean, again.
That's what I'm saying. I want you to talk to the leadership in Atlanta. I want you to talk to the VISN. I want to talk to your staff. And I want you to present me and the subcommittee with a date by which you think it's feasible to fill those spots.
I'll be happy to present you a plan, but also you're also setting up a date, in which I understand you're trying to do, to set up a date that may or may not be capable, because you couldn't get the same answer from Northside CEO or Piedmont CEO or anyone else.
I just know that deadline-driven work.
I agree with you completely.
Is often the most efficient and determined work, and I want something that's fair to hold you accountable to. So will you get a target date?
We'll work together to see where it's at right now.
Isn't it?
I'm not going to play the game. Okay.
What game?
Because it's not a game. Because there's no other facility in the world that will say by X date we're going to definitely have people hired.
I didn't say you definitely. I'm looking for a goal. You don't think leadership at other healthcare facilities set goals for when they're going to fill open medical slots?
I think they fill them as quickly as they possibly can. We hire over 1,000 people.
Okay. So you will not present a target.
I would like to have it. I would like to have them filled by the end of the fiscal year. That'd be great.
By the end.
Now, will it be filled? I'm not going to say they'll be filled, because there's a lot of other factors in there that I can't control.
Mr. Secretary, and I know we're belaboring this, Mr. Chairman, but this isn't a gotcha. What I'm saying, this is just good management practice. I just want to know. I want to know when you believe it can be done. I tell you what. Let's put it that way.
Hopefully.
No, you don't need to tell me right now. I'm not even trying to put. Why don't you talk to the VISN, talk to the facility, talk to your staff, and come back and let me know by when you think it can be done. Will you do that?
I look forward to the conversation. Yeah, I mean, I look forward to the conversation.
Will you let me know?
You're asking for me an answer that I can't give you because I've not talked to the other people.
I'm not asking for the date. I'm asking if you can give me a target.
Yes, I can get. We can look toward giving you a target. Yes.
Okay, that's all I needed on Atlanta, Mr. Secretary. Thank you.
Thank you.
I just got some additional questions about a letter that I sent you at the beginning of this Congress. But first, Augusta. WRDW, WJBF, Augusta reported this month, an IG report says VA Augusta leaders fostered, quote, a culture of fear with a, quote, threatening and abusive communication style, and allegedly retaliated against employees who shared concerns. I know the acting director was put on leave pending an investigation. I think that's a positive step. We spoke yesterday, Mr. Secretary. You confirmed you were recruiting for leadership at both of these facilities. Can you confirm that it's among your highest priorities to get a permanent new leadership staff in at Augusta?
Yes, and I'm to further elaborate without trying to belabor this because I know where we're at, but there's actually two incidences here that I'm going to report. The one that you just mentioned was done earlier, if not right before I came in, and that was the workplace issue, the leadership issue. That person actually was, I called, failed up and was put in the visit and administrative role. I made the call that we needed to put that person on administrative leave because if the reports had already shown that there was a toxic workplace, putting our veteran employees and our VA employees in a bad place in a workplace. So that one was out. That was the issue we did then. So then there's another that we tried to replace that one with that unfortunately I can't speak in open setting for personnel issues and reasons here, but has been removed as well. And that's when, as I told you yesterday on the phone, we now have another acting, I think is in now, correct? There's another acting is in at Augusta, and we are looking, to finish your question, I just wanted to give you the total picture. We are looking for permanent. That should be one of our flagship hospitals in our system, and so yes, we're looking for someone to take that permanently.
Okay, final issue, and thank you, Mr. Chairman, for indulging the questions. Sent you a letter February 13th, a number of members of the Appropriations Committee asking some basic questions about DOGE engagement with the VA at 13 specific oversight questions. You and I then spoke on May 6th. So we hadn't gotten any kind of meaningful response. You committed to get me meaningful responses. Still have not gotten responses to these questions. And I think this is an opportunity to bring transparency to an issue about which there's been a lot of public controversy and concern. So I haven't gotten answers to these questions that I asked and a number of members asked in February. So I want to ask you now, which DOGE personnel have visited VA facilities?
I don't understand the question.
Okay, which DOGE personnel?
Okay.
So personnel who are acting under the auspices or authority of the Department
we have
visited. Let's start with VA headquarters.
Are you talking about our liaisons who actually work for the VA?
I'm asking.
We have 3.
I'm asking which DOGE personnel have visited VA headquarters.
The ones that work for us.
Okay. What are their positions?
They're advisors. They're looking at through our contracts and stuff like that.
Okay. Are they still doing that?
Yes.
Okay. Have they accessed VA patient medical records?
They are acting in their role as employees as a normal VA employee would do and are authorized to do anything that they're currently doing. And I'll be happy to take these further for the record if you like.
Well, Mr. Secretary, I asked you these questions on February 13th in a letter.
Okay.
It's the end of June. I mean, you were a member of Congress. Would that be satisfactory to you?
If I'm offering you a solution, yes.
Well, we spoke in May.
And I'm offering you a solution.
No, come on, Mr. Secretary. I asked you these questions in February. We spoke in May. You said you get me the answers, and here you're saying you'll take them.
And in all fairness, you just asked me a question about who DOGE employees walked into my facility. Don't tell me you're trying to be serious about this. I mean, what DOGE employees? I mean,
no. What I just asked you was, what I just asked you is, have DOGE personnel access to medical records of veterans?
And I have told you that I told you they're acting in the roles under everything. That
there would be a lot less concern about this if the answers weren't so cagey on it all.
There's no caginess to it. Any VA employee who has access to anything and work at the VA is totally responsible and trained.
Let's work together, Mr. Chairman, to get some clarity on this because I'm not satisfied. It's been months. I don't know why there is such a lack of willingness to engage on this topic. We will follow up, Mr. Secretary.
Thank you, Mr. Speaker.
One thing that's really important, you mentioned that I'm an optometrist and eye doctor and practiced with 9 other doctors with the surgery center, and I really am very familiar with the